My guest today is an ICU doctor, regenerative medicine, anti-aging and aesthetics medicine expert, Chinese medicine master, medical genetics expert, smart meeting head investor relations, biotech advisor. She is a singer, wife, mother of 2 boys, Rotary Club Mabea proud member. She is passionate about life. She said, if I had to define myself, not easy, I would say that I am a restless mind, free soul, feverish brainiac, tireless traveler, unrepentant curious, passionate, mother, woman, enjoyer, vitalist, brave, free thinker, composer at times, voice from the heart, wanderer, warmer of souls, bridge of ideas, common thread, daring businesswoman, inconstant athlete, light, permanent illusion, open smile, hug ready to deliver. What a pleasure. And welcome. It's really lovely to have you.
Oh, thank you so much. The pleasure is mine.
Pleasure is mine. Like we had so much. See, Rotary Club brought us together. We met at the Rotary, my Rotary social gathering, and we had. I had never laughed so hard. Like it was a long time I had laughed that hard. I came back home and my cheek was literally hurting. Yeah. In a good way. So it was a good exercise. We had a good laugh.
That's
it was
fantastic.
So much fun.
This is health.
It was.
If you laugh and if you have fun with your friends, with your family, this is health.
It was really beautiful. Great connection. We didn't have any small talk. It was just like boop, boop, boop. I was like, oh, interesting, no? I want to know more about you, but then I found out that you're a doctor. I'm like, wow, okay, there's this topic that I've always wanted to talk about. I feel like women are not comfortable to talk about when it comes to vagina area. We really don't discuss this thing, and I just actually want to discuss the incontinence and this area, vagina area about women.
Yeah.
So first of all, what do you think causes this incontinence? Because it's the leakage of pee. Is that not what
it's
it
a mix,
is? It's a mix of
yes,
different
it's a
things.
mix of different reasons. You have incontinence for different reasons.
Right.
Normally, you get incontinence. The most common is when you get age, when you aging, and you arrive to the menopause. Then you have a syndrome. This is the menopause syndrome, and then you have this problem. You lose urine. Incontinence is you lose urine in a non-volunteer way.
Yes.
And we have different ways. You have the incontinence that you have when you cough or you make an effort. This is the most common one. And
this can happen also to young people. The cough one,
right.
Yes.
In young people, the most of the time is after the pregnancy.
Okay.
Because all the muscles in the pelvic floor they change and maybe they are weak. And then because of this, you cannot you can lose the urine when you make an effort.
Right.
Then we have another kind of incontinence. This is the stress incontinence, and this is different. This is when.
Sorry, it's okay. Okay.
The stress incontinence is when you want to go to the bathroom and you can't help, and then you can't control and then you lose. This is less common. The most common one is the effort one, when you make an effort. This is the most common. And
what do you mean when you make efforts?
When you cough, when you run,
right.
when you jump, and then you lose the urine.
So how can, because I know that this is something that a lot of women, young women especially, are actually going through. How do you think that it can be controlled after giving birth or even before giving birth? Because there are people who are losing pee without even being pregnant, ever being pregnant.
You have different options. Of course, we have since the less aggressive treatment to the most aggressive, that is surgery. There is surgery for incontinence also, but I don't recommend that.
Right.
So in the beginning, you can do exercise to make stronger the pelvic floor. This is Pilates, and there are a lot of different exercises you can do. We have experts, physiotherapy experts, that they are going to advise you the kind of exercise you have to do.
Right.
Also,
so do you know about this kettlebell? It's called kettlebell. Is that not what it's called?
The balls
Yeah,
that
you
you
can
can
use.
take in the vagina.
Mhm.
Yes, this is good also. You have to content the balls and
Release it again.
yes, so
Right.
you can do exercise with that. And for me, one of the best treatments is the laser. The vaginal laser is one of the best treatments.
Vaginal laser?
Yes,
Okay.
I have very good results with that.
Wow.
Why? Because the treatment with the laser, we put inside the vagina and we heat all the walls of the vagina.
Really?
And then, yes, not heat, so it's like warm.
Okay, warm it up,
Warm,
yes.
it's
Okay.
really heat.
It's a little bit aggressive.
No,
I was already imagining like, okay.
No, because it's a laser, it's erbium laser. And this is the laser we use for surgery. But in this case, we give less energy in a different way to give the energy, and then we warm all the walls of the vagina, and then we get to have more arteries, more vascularization. You improve the mucosa of the vagina, and then you get that the vagina is a little bit closer. You get that the muscles also works better because it has more vascularization, and you improve a lot the incontinence. You need around 3 sessions, but with the first session you notice, you realize about the difference.
Right. So is this recommendable in all hospitals and all?
Of course.
And is it affordable to an average person?
See, yes,
It
yes.
is affordable.
Every person can do that.
Okay.
Even when you have a prolapse, there is a big problem. This is the prolapse. It's when the utero and the vagina they fall down. This is a medical case. When this is not a big problem, we can improve also with the laser and avoid the surgery.
Okay.
So this is a very good treatment, and at this moment, I think we started to do this treatment at 2010, so more than 13 years doing the treatment.
Do you have results? Yes, great results.
Great.
So a lot of women can testify that it works.
Yes, yes. And now it's a normal treatment, because maybe 6 years ago people was a little bit surprised.
Yes, like I am, I still.
Sorry, I'm going to do laser inside the vagina. It's like something strange, but it's not. Now it's very common treatment. It's very safe.
Right.
Because the energy we use is tested, is checked, because we before to do the treatment in patients, we have to be that is safe, and it's really safe, and the results are fantastic.
Amazing.
And also other thing, because when you're aging and you have the menopause, for example, all the problem that you have is that the pain with the sexual relations.
When you're having sex, then you have pain.
Why? Because you lose your levels of estrogens, and then the vagina is dry.
So what's the remedy when in this case?
With the laser, you get the mucus improve, and the place where it produces the fluid of the vagina is the mucus.
Yeah.
So you improve the mucosa, and you improve the dryness. So it's a very good treatment for incontinence.
Yes.
And at the same time you are treating the dryness, and you improve your sexual relations. The vagina also is a little bit closer because the mucosa is bigger. So it's better for you, and it's better for your partner also.
Wow. So at what age can actually have these? Must you have the incontinence before you go for this treatment, or can you just have it just because you think you're arriving at a certain age and you just want to improve your sexual life, or because you just want to avoid having incontinence? Can you just have the laser treatment?
Yes, you can do the laser treatment even if you don't have the symptoms, because it's going to improve the health of the vagina, the walls of the vagina. I think if you don't have a problem, you are not going to need 3 sessions. Maybe you need 1 session to prevent this kind of problems. But it's a really good, and I recommend this treatment.
At what age? For example, 30 years, 35?
Yes, when you have children, after to have children, you have to wait some months after
after giving birth.
Giving birth, and then you can start. And I recommend that because it's going to improve a lot your vagina, and it is very important because when the women aging,
we don't talk about this.
We don't talk, and most of the women probably you don't think about this. But when you're aging, you think, okay, I have pain with the sexual relations, I have incontinence, but this is the natural evolution. So it's normal because I'm old, so I'm not going to. I'm 50, for example. This is not old. 50 years old.
No, today is not.
Yes, you are in the best moment of your life.
Yes.
And then you think, okay, doesn't matter because I'm not going to have more children. It's like nature has finished my. I have finished my function with nature.
Right.
So I'm not going to have more pleasure with the sexual relations. I'm going to lose urine. Okay, it's normal. I use something to
prevent it, so you be wearing a liner all the time.
Yeah. So women, we think the most of us when we get maybe 60, maybe 55, maybe okay, my function has finished.
I don't have to have sex anymore. I don't have to do this. I don't have to take. But this is the time you actually. It's the mindset.
This is the big mistake.
Misconception that we should try to avoid.
Yeah, because you can have a very healthy and a very plenty and a very
lots of sex when you're 50, when you're 60,
and much better because
much better. You don't care anymore. Like literally, I am not even up to 40, but honestly, I'm feeling. I open my mouth and I say what I feel, and I don't bite it. So I can't even imagine how it is when I cross 50. I think I will be those people that will be a stress shooter, like pop out. I'm saying it. So yes, you don't care anymore. You can't have
your mind is different than when you were younger, and you think another way. You see life in other completely way. So I think you enjoy it a lot, and you enjoy more than when you were younger. So 50
is just the beginning. It's the warm up. I can't wait then. No, but actually, I totally agree with you. I totally agree with you. I think I've seen women in their 50s today, and their life just started. The things they didn't do in their 20s, because in their 20s, in your 30s, some people were pleasing, like you were sexual pleaser. We were meant, I think, we just had that thing that sex was for men, to make a man come, to make a man arrive.
Right.
It wasn't about you as a woman. We don't sit down and think, what do I need? What do I want? I sex you, you sex me. It's no longer about, did you give him sex? No, there's this thing. It's different. Yeah.
When you are 50 or you're 40, 45, you think about yourself.
Exactly. We used to always think about the men.
Yeah. I think what I need, and now for me it's very clear what I want and what I don't want.
You don't even experiment. No.
And I have the control of my life. So it's a really good moment.
Yeah.
I want to say all the 15. No 15.
All the 15 women.
That is another it's completely different. No, but all these women, please, you have all your life, and you have the control of your life, and you have to do it for you.
Yes.
It's the moment. Doesn't matter if you have health problems, then we can solve. If you have incontinence, we can solve. If you don't, even when you are in menopause, you lose the
sexual desire. So how
do
you get that back? Because that's another
with
thing.
Hormones. Hormones treatment.
Yeah.
This is very important thing. In USA, is now in this moment we are doing the treatments that 10 or maybe 20 years ago they started to do in USA.
Right.
Now we are giving hormones to all the women that are around the menopause. Not needed that you are
Already in
menopause.
yes.
If you are around menopause, you can take treatment, and you are not going to lose the sexual desire, your vagina is going to be fine. Because, and the best treatment for me is the hormonal bioidentic treatment.
Right.
And you don't have to need to take pills. You can
just inject.
Yes.
Once a month. I have heard about that
under
actually.
the skin.
Yes, I have heard about these hormonal things, and of course the vitamins that we need to be taking our vitamins very serious.
Vitamins and a lot of supplements that you can take. But the most important thing are the hormonal treatment, because you need to have levels of testosterone. For example. Yeah. We are women, and all the people think about testosterone is for men. No. We need testosterone also for the sexual desire. So it's a really good treatment. If you put it under the skin, you don't need to take pills every day. Right. It's more natural.
But I also understand that if you, for example, if you start at a certain stage and start taking, I'm 34 now, and if I start, for example, start taking testosterone, my body will recognize the extra, body that is coming in and it will stop producing.
No, finally the body takes the testosterone and make the metabolism of the hormone. Right. But first you have to do a blood test. If your testosterone levels are fine,
or no, you don't need
an extra doses of testosterone.
Wow, interesting.
So first of all, you have to do a very good blood test with all the hormones. The thyroid,
I think it's
sexual hormones, everything, and then we can decide what kind of hormones do you need. Maybe you only need testosterone, maybe you need a mix of testosterone and estrogenous, or maybe you need all the things different. But we can analyze and we can say what you need. And this is a very important thing.
I actually, thinking about this, there's a conversation I was having, and some ladies were saying if you want to also control the pain thing, going back to incontinence, when you go to the toilet to pee, that you can actually have you pee, you hold. You pee, you hold. You pee, you hold. Is that kind of an alternative training for the vaginal walls, pelvic walls? Okay, it is good.
This is the same. This is the same that we do with the balls.
Right.
But without balls. Yeah. You do and you content. Yeah. You do and you content. But if you have a ball inside, also it's like you have conscience that you are doing the exercise. You have to hold. So this is the reason, because you use the ball. Yes. But also you can do Pilates.
Yes.
And there are other treatment that is not very common treatment, but it has good result. It's a magnetic chair.
Magnetic
chair.
Okay.
And then you sit down. And then you have magnetic waves, and this improves also the incontinence.
Okay, interesting.
There are a lot of gynecologists that they have in the clinic.
Wow, I've never heard of this one before. Yeah. Magnetic chair. So you just sit down and it kind of stimulates your pelvic walls and kind of
with waves.
Yeah, with waves. So because it's helping you.
There,
it's helping you do like this.
Contractions. Right. So you sit and you feel it. The same when you go to the gym and they use these things for the muscle.
Yes.
Electric stimulation. Yeah. Is something similar. So you have a electromagnetic stimulation, and then it's improved the pelvic floor.
Wow.
And it's very comfortable because you just have to sit.
Yeah, you don't have to do anything.
20 minutes more or less, and then you need several sessions, maybe 10, maybe 15 sessions. It's not the same than the laser. And they complement. You can do laser and then improve with the chair.
What's the worst case of incontinence you've ever experienced? Have you ever seen, which case would you say is the worst I've seen?
The worst case are the ones who go to the surgeries directly.
Alright.
They need surgery because probably they have a prolapse of the
The pelvic wall?
no, vejiga.
Vagina.
No, vejiga
Okay.
is.
That's a Spanish word.
No, I have the name. Is bladder.
Bladder. See, your bladder.
You can have a prolapse of the bladder. Also.
Right. Okay.
So this is very. You need surgery for that.
Okay. These
So
are the worst
cases. The worst cases they go to the theater.
What is a healthy vagina to you? Because actually, there's this, I think, even as a young girl, when I was in my 20s, I think we always had this conversation with my girlfriends, like, like how tight is the vagina? How do you even know what's a healthy vagina?
I'm a doctor, and I have been working a long time in this kind of treatment.
Right.
And already my friends, they don't say nothing about that.
They don't?
And yes, and just speaking casually some days, I lose a little bit of urine. Don't say that. Don't you tell me that you have this problem because I have the solution. So because we don't speak about
No, we don't.
We speak about the job, we speak about the husband, the most of the time the husband.
But we can't really talk about our own problems, this is true.
We speak about children, we speak about a lot of things, but we don't speak about us, about our problems, about our feelings.
Yes.
We don't speak about that because
you're scared of being judged.
Yes, we are doing everything for the rest of the people, the family, the people in the world. So we forget to speak about us and to think about how we feel. And the thing is that you have sexual relations satisfactory, healthy and satisfactory, and you feel good with that.
Right.
And you don't feel pain, and you feel desire. In that cases, the vagina is okay. But even this, you have to go to the gynecologist every year.
Yes.
After you start to have sexual relations, you have to go every year visit the gynecologist.
Important, very important.
This is very important.
Yes.
The gynecologist is going to look the vagina, the uterus, the final part of the uterus.
Yes.
The cervix, the name is cervix. And the gynecologist is going to detect if something is wrong.
Yes.
This is the medical part. But the physiological, the functional part, you are going to know if something is not
feeling right.
Yeah. If you feel good and you have desire and you have sexual relations.
Painful sexual.
If you
feel
good,
something. Yes.
This is the clinical part.
Yeah.
If you feel good, everything is running well. If you feel bad, you have to go to the gynecologist.
Very
and you have to see. This is very important. At the beginning that you feel something is wrong, you have to go.
Do you make your friends comfortable? As a doctor, do you make your friends comfortable to talk? I think so. From the little I've known you, I remember we were talking about so many things. Do you think your friends are comfortable enough to tell you things? To tell you about their vagina and their sex life and things like that?
No.
Do they feel shy to discuss
I think men speak more between them about sexual relations and about these things.
No, I think men brag about how I'm sorry. No man will. I don't think there's a man that will tell you that. I don't think my penis or my dick is big enough. I don't think any man will say that.
Usual, conversation.
They will always. I think, of course, they will boost themselves like I smashed her, very good. No man will tell you that.
No, yes, you're right, completely,
absolutely. I think women, me personally, I'm talking about me actually, because I remember when I was quite younger, I have a lady that I always think that she's sexually intelligent.
And you ask all the questions.
I ask all the questions, like, how do you do this? What should I do? Like literally, I asked that. Yes, I asked this lady. That lady changed my life. She changed. Till tomorrow, if you ever watch this video, you fucking changed my life like she did.
I think I don't know if it's the Spanish people or maybe it's the age, because we have different ages. But I don't remember to speak about this with my friends. And when you have your husband and you have your marriage, you don't talk to other women about I have this problem. I don't like this.
Yes.
The man do that,
Oh,
and
you
I don't
like
like
it. Nobody talks about. So how do we
Nobody
learn? That's the
nobody talk
thing.
about that.
Yeah.
My experiences, we don't speak about that. My husband is good, is bad, they go with the
Yeah.
children.
How can I tell him
They
to do this?
don't give me gifts, and they are something like that.
Yeah,
Don't speak about the sexual relation with
Yes.
husband. With I have this problem, I have that. No, people don't. Women here, we don't used to speak about this.
I'm very curious. I need to ask people around. Honestly, how did you learn? Because I don't know. How did you learn about sex? How did you learn about your body? How did you learn about sex?
Yeah.
As a body of its own.
This is
as a
the thing
woman.
that it has changed a lot because
I think
because when I speak about all these things, the treatments and the incontinence and the dryness and all the things, the gynecologist and we have gynecologists and we have aesthetic doctors as me that we are specialized in this part, in the aesthetic gynecology. And we have a part, this is the regeneration in the gynecologic aesthetic.
Yeah.
So we don't do only aesthetic gynecologic, also functional to feel better, not only to look better, because you can do your genital part look better.
Right.
Also you can do that it works better, the function, improve the function. And in this part, when you want to improve the function, you have to have professionals in sexual advice. Yes. Not gynecologists. No. They're experts like sexologists. Sexologists. Yes. And we have we have add this kind of professionals to this process. Why? Because it's a very important part. The psychological part, when you think about sex, and when the ideas that you have about sex. So sometimes we need more things, not only the treatment, the medical treatment, we need the psychological treatment. And this is a very important thing. Above all, when people is old, that the thing I'm speaking with you, we never have been speaking about sex with friends, we don't have more information. So then you need a professional, and the first thing that the professional tell you is you have to know yourself. Take a mirror. Look. And look. Yes. Said and look. Oh, there you are. This is the first thing. Take a mirror, look, and then you know how is your sex. Yes. Because maybe you never have seen. I don't think a lot of people. I think a lot of women have this. Have you seen your vagina, by the way? So take a mirror. I think this is going to be the slogan. Take a mirror and look. Hello, is that you? Yeah. Yes. And then you have to explore how you like. Yeah. What do you like, and how you like that the man or yourself or older women, that's mother, how you like they touch you. Yes. This is a very important thing. And what is in your mind? Maybe you have a barrier there, but maybe you have there's something blocking you there, reaching an orgasm and all that. So this is a very important part. So you need to have. Yeah, we have to talk. Yeah. I'm here. We can talk. And I'm here. I feel super fine here. Super good. Wow. So no, but this is a good slogan. Take a mirror and look. See yourself. Yeah. The first thing, know you. Because if you don't know you, don't even know how to tell the next person how to treat you. So you need to explore your body, identify what you like and what you don't like, and then be able to teach someone else. This makes me uncomfortable. A lot of women call, fake, of course. Fake orgasms, like it takes a long time before you actually start really having, at least me, having a real orgasm, because you just want to make the man feel good. Like, yes, I just came amazing. No, in your head, like, what the fuck? A lot of a lot of women. Yes. And this is because you don't think yourself. You think about the pleasure of the other pleasure. Then that's the problem. You don't think in this. And this is not only in sex. This is in life. But do you think
ready to take the not really critic, it depends on also how the message is being sent. For example, if you want to tell your partner or your boyfriend, your husband, that he's not doing this, right? He's doing this way, doing it this way. I don't think so men are ready to take that, because it kind of rubs them on their ego. Some of them are not open, some are, but some are not. So how do you think this communication should be transcended? Like, if you do it this way, it's much better. I feel more great. So again, it's the communication method.
Yeah, I think the most important thing, the first thing, is that you are sure about the thing that you want. Because if you don't know what you want, you cannot communicate nothing. What are you going to communicate? So first, be sure about what you like, what you want, what you need. But this is not only in sex, this is life. The only responsible of your happiness is you. Me. And then if I'm happy, if I identify what I need to be happy, I'm going to feel fine, I'm going to communicate the other, and I'm going to make him happy the others. But the big responsibility is to be happy yourself. This is the big responsibility in life. And we are wrong, we think, I have to give him what he needs. But in other cases, I'm going to lose him.
But actually, also, most men I've also talked to, they actually are happy when they know that they are actually satisfying you 100%, not in a faking way, but 100%,
Yeah, and more men, they identify this, and they like to give pleasure to the women.
I think most men
do. Yeah. But the woman has to know what she wants. You have to be sure about that.
Age.
What?
This one comes with age. Knowing what you want. It comes with age, I think it comes with age, because the more, of course, I think looking back, the girl I wasn't mine, so maybe it's not the girl absolutely is not the girl I am in my 30s. And it comes with age, realizing,
you're a better version of you, and you will be a better version in years. Listen to me, because you learn, you have more experience, and you know more yourself.
Exactly.
And this is a big responsibility, because somebody, your friends, your husband, you don't make me happy. You say, I don't have to make you happy.
No.
I have to make happy myself. And then you will be happy.
Because you feel it.
And you will be by my side, and you will be with a woman with a woman who is happy and who wants.
Automatically it goes to the partner, to the children, and everybody is happy, and the society is happy. Me. It's not selfish at all.
And this is not egoist.
No, it's not.
This is needed.
It is important.
This is my philosophy.
I love your philosophy, and I believe in it, and I apply it. I prioritize me a lot. You're a doctor, your wife, your mom. So how do you balance all these things as a woman? Because again, you first.
Yes, but because I think what I need, what I like, and then I go for it. I go ahead. So I like to be a doctor. I'm a woman in business also, because I work in business.
Wow.
I have my children. I have my music, because I am a singer also.
Oh,
so, yeah.
Really?
Yeah.
Okay, there's so many things about you I didn't know about.
So I need to do all of these things. And when you really want to do something, you find the moment.
You find how to balance.
Yes, you find how to do. And
I understand your husband is also a doctor.
Yeah, also doctor.
Wow.
Yes, and we work together in the same place. I see you, doctors.
Oh, really? That's really lovely. Yes. So balancing it is not a problem, because you know what you want.
Yeah.
family have integrated to your life, because at the end of the day, mama gotta be happy, papa gotta be happy, and then the children will be happy.
Yeah.
If both of you lose this balance, the kids can get it.
Absolutely.
Yes.
This is the way.
Yes. Oh, this is lovely. Thank you so much.
Thanks to you.
No, thank you so much for really sharing a little insight of your knowledge, because this is just a nugget, like literally a tip of an iceberg of what I think you've got inside you, and I am so privileged to have you. Thank you for tuning in. For more, stay here in Women's World Show. My name is Clara Chizoba Kronberg.